For the best in eyewear, call Dr. Leak's Optometry.
This is something that we may be dealing with for many years to come. It would be lovely if we could give patients a time frame, just put up with it for 6 months and it'll go away, but we can't say that at all. Patients are experiencing symptoms 2 years out, and the clock is still ticking.
Dr. Englund says people are experiencing all kinds of long hauler symptoms, but the most common seem to be overwhelming fatigue, persistent cough, shortness of breath, heart palpitations, lightheadedness, brain fog, muscle aches, chronic constipation or diarrhea, lack of appetite, and loss of sense of taste and smell. Unfortunately, there is no one-size-fits-all treatment, so patients typically have to meet with different specialists. Dr. Englund says they have learned quite a bit during the pandemic about long haulers. For example, it doesn't matter how severe the person's case was, anyone could be at risk. The same goes for whether or not they are vaccinated.
We are seeing patients who've been vaccinated also presenting with COVID, or the long COVID syndrome. Sometimes it's because they've had their 2 vaccines but haven't necessarily had the booster, so they might have been more susceptible to the Omicron variant. So overall, I would say that the vaccine does protect against long COVID, but that's certainly not 100%.
Dr. Englund says they are also researching how each variant impacts long hauler symptoms. With that being said, she continues to emphasize the importance of the vaccine and booster shots.